So we have here a clinical example, energy treatment of musculoskeletal pain. A 45-year-old man comes in with an acute backache and sciatic pain. This pain started suddenly on lifting a heavy box off the floor a few days ago. The pain is mainly on the low back left buttock and radiates down the back of the thigh to the ankle. He cannot stand or walk with pain, but is comfortable when lying in a curled position. When standing, he leans forward and away from the side of the pain in order to relieve it. The patient was treated daily and the pain reduced each time after treatment. On the pain scale between 0 and 10, he indicated 10 at the start of the first session and 2 at the end of it. Some pain returned, and at the beginning of the second session, he gave it a score of 6 and 2 after the treatment. On the third day, he walked well, could stand straight, and had needed no pain medication. He gave the pain a score of 4 at the start and 1/2 at the end of the third session. The treatment was then given twice in a week. After 5 sessions in all, he was completely free of pain. Diagnosis is urinary bladder meridian heart pain. The patient suffers from an acute yang dominant pain on the urinary bladder meridian. There is a yang excess situation in the meridian which should be sedated. Treatment: 4 local points, bladder 24, 27, 54, gallbladder 30 with electrical stimulation using 5 to 10 hertz, continuous frequency, 20 minutes. Urinary bladder 63 sedation, the she cleft point, SI7 sedation at the end when local needles have been removed. So this is the 1-point therapy. Bladder 40, distal point for the back. For ear acupuncture, we used sciatic nerve, kidney, and Shenman. In this case, the patient was given 4 local needles, but all of them were continuously agitated through electrical stimulation. This amounts to steadily vibrating the needles for 20 minutes, similar to the hand technique of needle sedation. All other needles used were distal points to the affected area, especially point SI7, which was the most distal point, as it was on the arm meridian of the same polarity as urinary bladder. Also, 2 distal and 4 local points were all sedated to disperse the excess energy away in this excess situation. Now let's go to clinical example 2, energy treatment of musculoskeletal pain. A woman aged 52 came in with a chronic backache for 8 years. She was not able to do housework for more than half an hour as her low backache would rapidly increase to the point when the pain went down both her legs, making them feel weak. The pain would disappear within 10 minutes if she sat down, and then she could stand up once more to continue her work. She took a folding stool with her when she went out. She had been quite slim in the past, but now she was gaining weight because of the lack of exercise. She had been treated with painkillers, antidepressants, and had 2 epidural injections at the hospital, but the pain was gradually worsening. The last 2 years had been particularly bad. Diagnosis: chronic heart pain on the urinary bladder meridian, urinary bladder, and kidney. The patient had a yang dominant pain as it was worse on standing and walking, so the yang, and improved when sitting and resting in. But it was a chronic backache with an 8-year history and seemed to have worsened in the postmenopausal period. The treatment, therefore, was to treat the heart pain locally and to tonify the yin of the urinary bladder meridian and to tonify her kidney yin, which seemed to be deficient during the menopause. 4 local needles, 2 on either side of the low back with electrical stimulation, bladder 40, distal point and earth point, grandmother point, which tonifies the yin, kidney 7, tonification point, tonifies mostly the yin in the kidneys and indirectly also in the urinary bladder. REN3, the front mu point of the urinary bladder, can be used to tonify the yin. Patient was advised to do some light abdominal exercises on the bed, to bend each knee and bring it up towards her chest a few times. She was also asked to drink more water and to reduce the medication with the reduction of pain. She was treated twice a week until some improvement was noticed, and then once weekly. There was no significant change in the pain for about 2 weeks. That's a total of 4 treatments, and then she felt better and stronger in the back and legs. Each time, the pain medication was gradually reduced. She had some worsening of the pain, but adapted well. After the once weekly treatment for 10 weeks, she was treated fortnightly for a month before the treatment was ended. She continues doing the abdominal exercises and takes short walks regularly and care not to exert herself too much.